Hello all. We have over 300 videos on social media, and I believe we've addressed many questions in these videos. But my assistant still told me that I have these questions of yours, and they collected these questions from you and put them in this glass lantern. In this video, I will try to answer the most frequently asked questions you have asked me. Ready? I'll start with the first question. Opened it. Does myocarditis recur? Means heart muscle inflammation. Myocarditis rarely recurs. Will you have heart muscle inflammation again? Is this very risky, teacher? Am I in danger? Don't mention that my heart failure will worsen. Myocarditis is an uncommon and harmless condition that seldom returns. I suggest watching our myocarditis video. Moving to next query. Are all BP meds the same? We have 5 main groups of BP meds and they are all different, and the BP meds that should be preferred for heart diseases can vary from person to person. Not all blood pressure meds are the same. Your neighbors may not be good for you. The med that lowers your friends may lower yours even more or not at all. One medication may not be enough. Combo therapies can be used. BP treatment is personalized. The most beneficial medication is the best, and sometimes changes may need to be made to the treatment during follow-ups. If a person uses the same med for 10 wars, it's likely either insufficient or excessive for them. Does excessive vitamin D poison? No one's D level should exceed the norm. Just as D deficiency is risky, excess is also risky. When vitamin D is always exposed to the face, it can cause calcification in heart vessels, rhythm disorders, kidney stones, and bone loss. Excess of vitamin D is not better. Having more of anything doesn't mean it's better for us. If your vitamin D level is greater than 100, it is time to decrease your vitamin D supplement. I'm moving on to my next question. I'm opening. What's the main artery? How many arteries? Risks if it gets clogged? Bit long. Heart has 3 main. If any of the 3 main arteries is blocked, a heart attack occurs. We call this one of the 3 heart-feeding veins the main vein. On the left, 2 main veins merge to form the root vein. Let me give you their names. The main artery on the left is abbreviated as LAD, which stands for LAD. CX vessel goes from left to back. On right we have RCA artery. Vessel is in our CX system. If any of these 3 main arteries are blocked, we'll have a heart attack. We already do these artery procedures with stenting. I can say these 3 are main arteries from the aorta. Can heart patients take antibiotics? Heart patients are human too. They can get infected. Antibiotics may be required for them. Unfortunately, we can't use some antibiotics in heart failure. If heart functions are very low, we may not be able to use some antibiotics. So using the same antibiotic all the time may not be suitable for you. If you have heart failure, if you have a condition of an underlying infection, please inform your doctor. Additionally, rhythm problems can occur in heart patients. In these cases, we also avoid rapid-acting antibiotics. So I can say antibiotic selection is personalized. Heart patients should consult their doctor when they need to use medication. Moving to next question. Does sleep apnea cause a heart attack? Sleep apnea is a really dangerous disease and it can bring along risks. Sleep apnea does not directly cause a heart attack, but the constant decrease in oxygen during sleep can cause stress to the body and can lead to damage to the heart and blood vessels. Taking a few sleeping pills does not cause a heart attack, but if you have a sleep disorder, please seek treatment. Supine sleep, interrupted breath, increase heart attack risk. Avoid constant supine sleep to reduce this risk over time. Treat sleep apnea, reduce heart-related risks. Moving to next quiz. How are coronary artery blockages detected? Diagnosing them is easy. You can see the main veins on both sides of the neck with an ultrasound procedure. Ultrasound is performed, it is safe. Is there any blockage in the coronary artery, any plaque, any hardening, can be understood. If there's a serious narrowing in the coronary artery, we correct the diagnosis here with an angiographic procedure. If there's a real artery blockage, we open it with a stent procedure. Coronary artery blockages are diagnosed with ultrasound and can be opened with angiographic procedures. We no longer do as many surgeries for coronary artery blockage. We typically open jugular vein obstructions with non-surgical methods. Uptime is typically 15-20 mins and PT is discharged the next day. Moving to my next question. Can heart palpitations cause a heart attack? Palpitations never, but never cause a heart attack. Palpitation is not a disease. If over 10K, 15K, 20K heart palpitations per day very rarely, risk of heart failure may continuously increase for that period of time. Heart palpitations are usually harmless. They don't require treatment. We call them early beats, extrasystoles, premature contractions. We are not afraid of heart palpitations. I know it's bothering. I know it feels like a bomb is exploding inside you. I know it feels like your heart is falling into emptiness. But we are not scared of heart palpitations. Sometimes it can cause panic. Usually, no medication is needed for heart palpitations. Suggest making peace with stutters. Moving on to next question. Many questions. Answer is ongoing. If there are heart diseases in our family, when should we go for a checkup? If there is a heart stake agreement, all males should be screened at 18. If someone in your family has had a crisis at the age of 45, you should go back 10 years and start checkups after the age of 35. If someone under the age of 65 in the family has a crisis, it means a genetic risk of cardiovascular disease. Other family members should be cautious. If there are accounts of early heart attack, early stroke, angina, stent, bypass in our family, it's advisable not to neglect your checkups. Yes, having a family story is important to us, but actually what is important is the controls. If there is already a risk in the controls, we detect it. Don't fear, come for check. Moving to next question. How long should magnesium be used? Magnesium can be used continuously. If you have hypertension and your diet is deficient in magnesium, you don't need to restrict yourself from magnesium for a while. No need to say I'll use it for a period and then cut it, but we want to use magnesiums primarily for their intended use. If there's a sleep issue, if sleep process is gone, if illness is eliminated, if problem vanishes, it can be halted later. If there's an issue with restless bowel, magnesium can be used as an aid and then magnesium can be stopped. If you have hypertension, heart disease, diabetes, and a clinical inflammatory disease, you can use the chosen magnesium form for a longer period of time. But I want to draw attention to one point. More important than supplements is to get enough magnesium with your diet. Magnesium is acquired through nutrition. Nutrition comes prior to taking supplements. Moving to next question. What if you start the day with coffee upon waking? Nothing bad happens. But starting your day with coffee will lead to a caffeine dependency, making it difficult to quit. We suggest having 2 cups of coffee at around 10 a.m. and 2 p.m., which are the recommended time periods for optimal consumption. Ideal coffee hours. If you start the day with coffee upon waking, you won't get sick. But caffeine intolerance can develop. We don't want this either, so, if possible, around 10. Consume cortisol after it drops a bit more for benefits. Moving on to my next cues. What is a secret sugar? Doesn't diabetes show symptoms? Hidden diabetes is not hidden from us. Hidden diabetes is blood sugar level 6 to 6.5 for 3 months, fasting blood sugar level 100 to 125 in the morning, consistently high postprandial blood sugar not exceeding 200. Hidden sugar can be concealed, may lack symptoms. Not a secret from us. Blood counts reveal presence of hidden sugar. What's hidden from you isn't hidden from us. Ensure to get blood tests every 6 months or once a year. Insulin 3-mo sugar and fasting blood sugar test vital. Don't fear hidden sugar, fear not making changes. Moving to my next question. What is heart palpitation? Palpitation is premature beats in the heart. Hearts feel like falling into emptiness. Feels like a bomb exploding inside. Some patients say it. Feels like my heart falls into emptiness. It's like one of them is throwing early while continuing to throw normally. So everyone's feelings are a little different. It can be louder in some. Different denominations for this. Premature beat, extrasystole, premature contraction, all arrhythmias. Comparing the situation to a car is like when a car stops, palpitations don't raise heart attack risk. Heart failure does not increase risk. It does not cause cardiac arrest. Heart palpitations are usually benign and do not require treatment. In this video, I answered your questions. We'll add them to the forum. Please keep asking. In our upcoming videos, we'll answer your questions. Stay connected. Remember to subscribe. Bye.